Good morning, and thank you for joining the City of Lubbock's COVID-19 news conference. We appreciate you joining us today for this condensed version in a different time format, but directly following this one at 12:30, the Texas Tech University system and the Texas Tech University Health Science Center and the Health Science Center in El Paso will be hosting a virtual town hall meeting called This Is Your Shot, Vaccine, Facts, and Science. Our own Dr. Cook will be joining that one as well. So right after this, when we get done, we'll be finished at 12:27, 12:28 with our news conference. We will share the link to the Texas Tech System Town Hall on our social media sites. So today's panelists for us are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, and Lubbock Mayor Dan Pope. So let's get started with Catherine Wells.
Thank you, Lacey. I really want to start off this week talking about how excited and thankful I am about the number of individuals that have come out and gotten vaccine. For the last 4 weeks, we've seen a large increase in the number of people vaccinated, and we even vaccinated 1,000 more people this week than we did that previous week. I want people to know that vaccines available at the health department, but it's also available through all of our community partners. I was recently at the pharmacy over at United, and that pharmacist was telling me that he had vaccinated 45 individuals the previous day. So lots of places to get vaccine. Vaccine is free, regardless of your insurance status. There's no copay, no charge for anybody receiving that vaccine. So if you haven't gotten vaccinated yet, it's critical at this time for us to get people vaccinated. So please do your part. I also wanted to mention about our testing clinics. We are operating a free COVID testing site. That site is moved from the health department over to Clapp Park. It's located in the Clapp Park Pools parking lot. That's a drive-through testing site that is a collaboration between Texas Tech's laboratory, health department staff, with some support of the Texas military. That clinic operates from noon to 6, Monday through Friday, and those test results are ready between 24 and 48 hours after testing, and you will be contacted by the health department regardless of that testing. With our increased COVID rates that we've been seeing over the last few weeks, again, I encourage everybody to get vaccinated. Again, it's free and it's easily available. With that, I will send it over to Dr. Cook.
Thank you, Catherine. I appreciate that. You know, thanks to everybody that's come out the last few weeks and received your vaccine. That is good news. That's really going to help us slow down our rate of infection in our community. Our hospitals remain full, our ICUs remain full, and please know that 90% of our hospitalized patients here in Lubbock remain unvaccinated. The average age right now is a much younger age that's hospitalized. The average age of the hospitalized patient is 53. The average age of the patient on the ventilator, the breathing support machine, is 48. Those are very young ages. Yes, some of those in our hospitals do have breakthrough infection. We are seeing an increase in breakthrough infection, but those numbers remain very low. If you are vaccinated, you are much less likely to be hospitalized, so low that it's hardly measurable. We have a few in the hospital, but not very many that are vaccinated. So with that, I want to go on to my next topic. Many of you are anxious about receiving this vaccine. You're worried about the safety of this vaccine. Vaccinologists, or those scientists that study vaccines, especially this mRNA vaccine, this science is not new. We didn't hear about it. Most people didn't hear about mRNA vaccines until COVID hit. But that science has been around for many years. They've even used it in cancer research to tag cancer cells and direct those mRNA responses directly to those abnormal cancer cells. So it's been around a long time. It is extremely safe. They have to use the same safety standards as any other vaccine. Another good part here is that both Pfizer and Moderna enrolled more than 40,000 patients apiece in their clinical studies to prove to the FDA. Now, this is prior to the emergency use authorization. They both enrolled 40,000 patients plus to show how safe their vaccine is. When drug companies introduce their drug to the FDA for approval, some of those studies only have 3,000 patients in them. They had more than 80,000 total to show how safe this drug is. We have given 357 million doses of these vaccines and had relatively few side effects other than the typical soreness and the muscle aches and the low-grade fevers. But there have been a few things that have popped up. When we give a vaccine, because it's not given every day like a new drug, if a drug company starts out a new blood pressure drug or a new diabetes drug, we have to give that every day. And that's why their studies go on for months or years to show how safe it is. Vaccines are one-time dose or two-time doses, and side effects, severe side effects, pop up a couple of weeks after that. And the other thing, that once that vaccine is injected into your arm, it is destroyed by your body after a day or two. So it doesn't hang around. So that's good that it doesn't hang around, and that side effects only pop up a couple of weeks after that. It's in your body long enough to stimulate your immune system to say, oh, hey, that's a spike protein on a COVID virus. So the next time I see that COVID virus, I can fight it off. That's how these vaccines work. So they don't hang around, and side effects only pop up a couple of weeks afterwards. Now, some of those severe side effects, I'm not talking about the muscle aches and the sore arm and the low-grade fever, but you've heard about Guillain-Barré syndrome. That's that neurological disorder. You've heard about heart inflammation or myocarditis or even blood clots. Those have been associated with the J&J vaccine, but we expected those to happen. We see those scenarios, those symptoms, even if you were to get COVID or other viruses. We've seen those blood clots and heart inflammation and Guillain-Barré syndrome. We've seen those in regular viruses without the vaccine. And so when we give you the vaccine, we understand that they may pop up, and they did, but very, very rare. Now, the last thing I want to address here is the number of deaths related to the COVID vaccine. There is all kinds of disinformation on the internet about the number of deaths related to COVID vaccine. There have been only 3 deaths related to COVID vaccine, just 3. Those were from blood clots early on after Johnson & Johnson was administered. We know how to treat those blood clots. We know how to treat Guillain-Barré syndrome. We know how to treat heart inflammation if you get those. They are very rare, but only 3 patients have been attributed to the COVID vaccine that have died, and it was related to the blood clots in the brain. You may remember that early on. And those side effects can happen from other vaccines too. They're so rare that the other vaccines, we don't even mention them anymore. Let me again say that this vaccine is very safe. Even the American College of Obstetrics and Gynecology, the Society of Maternal and Fetal Medicine, that's the group that does high-risk OB, the American Academy of Pediatrics, the American Academy of Family Physicians, and the American Academy of Chest Physicians all have said this is a very safe drug to use before, during, and after pregnancy. So it's safe in pregnancy. The last thing I want to talk about, the FDA is talking about booster shots. You may see some information coming out very soon for everybody, at least 8 months after your last dose. That hasn't quite hit the presses yet, but look for that. And also, please wear your masks. This Delta variant is around. It's causing more significant disease. Please wear your mask. Nobody likes to wear them, but we must stop the disease and get your vaccine. That's all that I have for now. Let me hand this off to Mayor Pope.
Thank you, Dr. Cook, Ms. Wells. Good morning, everyone, or good afternoon, everyone. It's nice to be with you. I'll start by doing a quick screen share and sharing some data. Okay. First is our hospitalization rate. You can see the increase in this rate. Remember, the 15% is just it's a guideline. It's something that we would like to stay under. I would mention, and in our trauma service area B, as well as around the state, that there are many fewer beds available today than there were last fall or even early this year. That denominator being lower, accelerates this hospitalization rate, and that those beds are not available due to labor shortages. I'll comment a little bit more on that in a few minutes. You can see our case count by age over the last 2 weeks. Unfortunately, we're seeing a larger percentage of new cases in our 30 to 49-year-old group. Those are, as you followed this data over the last 6 or 8 months, you know that 18 to 25 has led by a long shot. And what you see, and you'll see on the next slide, is that there's sort of an inverse relationship between new cases and vaccines. So this is percentage of residents with at least 1 dose. You can see that where we have the lowest percentage of residents with vaccines, we have the highest number of new cases. I guess that makes good sense. Let me leave this. I'll comment a little bit more about vaccines. Okay. First of all, just to pause and express my sympathy to families and to friends, folks that have been impacted by this vaccine, whether they are fighting it in the hospital or have come home but are dealing with the lingering symptoms, or if it was deadly. I just my thoughts and prayers. I know people in the hospital as we speak, and it is a struggle. The state has been helpful with our hospitals. I mentioned the labor challenges. We've got nearly 50 new either nurses or respiratory therapists between Covenant and UMC that are coming in this week. The governor's office through TDM took that action late on Friday afternoon last week, and that was at our request, and we're thankful for that. We're also thankful that our infusion center is still operating at 50th and University, and not only is it still operating, the capacity is being increased. So messaging is a little bit different. If you test positive, we want you to talk to your doctor. Your doctor may tell you to go to the infusion center. You may get a referral to go to the infusion center based upon other health issues you have, age, et cetera. The infusion helps you stay out of the hospital, helps you get well. It's very valuable. Like the predecessors on this call, and particularly Ms. Wells, I'm thankful for the uptick in vaccinations. They're available all over the community. They're free. Did I mention they're free? They're safe, as Dr. Cook talked about. Please don't rely on your antibodies from having COVID a year ago to protect you. I was having coffee with a good friend this week who told me that he decided to get vaccinated just last week. And he had been reluctant to be vaccinated because he had had a tough case of COVID. However, a mutual friend of ours is in the hospital after having had a tough case of COVID, not being vaccinated, and now having the Delta variant. It's important that you consider being vaccinated. I'm thankful for the town hall that's going to follow us today. I know it's in an effort to educate people, and I think that's really important as our citizens make decisions about being vaccinated. Let me finish with this. We have 186 people in the hospital with COVID COVID-related cases. 10% of those have been vaccinated. So pretty equal to the national average. About 1 in 10 in the hospital had been previously vaccinated. In ICU, we have 54 patients. One of those patients has been vaccinated. Your chances of a serious illness are much reduced if you've been vaccinated. Overwhelmingly, evidence shows these vaccines are highly protective against serious illness. Please consider being vaccinated. Lacey, back to you.
Thank you, Mayor, and thank you to our panelists. We will now open it up for media questions. Dr. Cook had to get off so he could go to get ready for the town hall. Due to our condensed time, we actually have about 11 minutes left of this one. Media partners will be allowed to ask one question. If you have more questions or you have a follow-up, just email me and I will get those answered for you. First, we start with Karen McKay with KCBD.
Good morning.
Good morning.
Hi.
Karen.
We heard earlier that 8 months into you could get the vaccine. We're about 8 months in from those first vaccines, which would mean that some would be ready now for a booster. Do you have a plan in place for giving out these booster shots now that the government it looks like they're going to happen in a few weeks?
We do. Catherine, you want to talk about that?
Yes. Well, we're still waiting for the final approval from FDA and ACIP to make sure that they are going to approve that booster shot after 8 months. One thing that's very different now with the booster shots than what happened last January is we have lots of community partners with access to vaccine. We have vaccine in all of our pharmacies. We don't have a shortage now. But with that said, we are looking at opening a larger vaccination clinic to the public. And those plans will be released as soon as they're finalized.
Okay, thank you, Karen. Now we move on to Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. I hope you're well. Personal responsibility seems to be the name of the game of this COVID Delta virus. Even the governor of Texas, who has contracted COVID, has credited the vaccine for fewer symptoms. That said, what populations continue to avoid or are you lagging to connect to provide the vaccine to? And I know that there's a lot of efforts, and I appreciate that, Catherine, because we've got them listed in our events calendar, but what groups are you still having a bit of apprehension or just not connecting with that maybe we can help?
As far as age-wise, we still, and if you refer back to the mayor's chart there, we are not vaccinating our middle-aged people. That age between 20 and 50 are not having the uptick of vaccines. We do have lower rates in some of our minority communities, and that's why the health department's focusing on those pop-up clinics. But vaccines available all through our community, and we really need everybody to step up and get vaccinated. Our seniors have done a great job. We're at 70, 75 plus with our senior population, but in order to slow the spread of this, we need those younger folks getting vaccinated.
To build on that,
And I know we're limited
to build on that.
the 20 to
Go ahead, Christy. I'm sorry.
I was just going to say the 20 to 50, what efforts are being done to connect with this particular population?
Well, I think it's a great question. One, we're working very hard with Texas Tech and Lubbock Christian. We've got vaccine efforts going on as they check in even as we speak, through whether it's our health department or through the state or through our partners like United Supermarkets. So we're really trying to get to the college kids who are very active in our community. we will continue to message. One of the reasons we moved our press conference back 30 minutes today is we want people to listen into this town hall. We have a lot of folks that have questions. The town hall will be based on science, and they're going to talk about why the vaccine is safe and effective. Christy, if you've got ideas about places we can go that we're not, please let us know. We want to take the vaccine everywhere we can. You're on mute, Lacey.
Sorry. Now we move on to Rob Avila with Texas Tech Public Media.
Hi. So the mayor touched on this, but we've heard there's been an influx of patients at the Therapeutic Infusion Center, which provides the same antibody treatments that Governor Abbott just received. Is there anything more people should know about that care option?
Well, I think we want you to talk to your physician and let them refer you there. We've been doing these now. Catherine, how long has the infusion therapy been available? 9 months? Longer than that.
Yeah.
Why don't you take over and make this sound more official?
Okay. The other one is the infusion therapy has been available at that site on 50th and University. If you do not have a primary care physician and you test positive for COVID, please call the health department. We can do that referral for you over the phone and get that screening done. So don't let a lack of insurance or a lack of access to primary care prevent you from making that phone call. Call us. We will get you referred.
Thanks, Rob. Great question.
We need to step it up a little bit. So now we move on to Matthew Stell with KLBK.
Lacey, thank you very much. Just a quick question here. We heard Dr. Cook talk about how our ICU beds are filling up here in our area. What's the plan? Of course, God forbid, what's the plan if our ICU beds continue to fill up and there's not enough room for folks who may have life-threatening injuries, let's say a car wreck or a stroke or a heart attack? What's the plan? Where do they go? We transfer it somewhere? How will that all work out?
Yeah, so it's a good question, Matt. First of all, unfortunately, we've been through this before. So we have a plan. The staffing that I talked about earlier will allow us to open more ICU beds. I think you've already seen our hospitals be less likely to take transfers over the last week. There was a 10 days ago, 2 weeks ago, we were still taking transfers from many parts of Texas as well as other states. So we've started to tighten that down. We know that by doing that, we can keep beds available for those emergent cases that you mentioned. But that is the message, Matt, and that's why it's so important that we get people vaccinated, keep them out of the hospital, because those beds need to be available for cases, those emergent cases, that heart attack, that car wreck, the stroke, those type of things.
Okay, thank you, Matt. Now we go to Katie Gray with KMAC.
Can you hear me?
Yes.
Hi, thank you so much. Okay. So my question is a little bit kind of expanding on the sense of, we've heard many from a lot of hospitals running out of bed, being at capacity. Is there any plans or any strategies when it comes to nursing shortages or even staffing?
Well, I think I've answered that question. Have you been on the call?
Yes, I'm sorry. Maybe just to expand a little bit.
We're doing all we can to get, more nursing capability. We've both actually Covenant, UMC, and the Heart Hospital have requested help from the state. The state has been able to help to some degree for Covenant and UMC. We're working on the Heart Hospital as we speak. They don't have as large an ICU, but nonetheless, they are taking care of some sick patients, and we want to make sure we try to help them. And we'll continue to advocate for more nursing. COVID in the last 18 months has been really challenging for nurses. We've had a lot of early retirements. We've had nurses that have decided to go do something else. We have nurses that are traveling to maybe get to make more money and be COVID nurses somewhere else. So we work closely with our hospitals. We're working closely with the state. We'll continue to do that.
Thank you, Katie. And now we have Olga Aguero with El Editor.
Buenas tardes, good afternoon. Real quickly, it's really the doctors that this question goes to, but since the booster shot was touched on, the booster shot, I guess to Karen, is not gonna take the same process like the previous shots. It's not gonna start off with the most vulnerable and all that. The vaccine is going to be so available that it's for everyone is eligible for it. But we can touch on that later on, but I think that's important.
Well, it will be a multi-step process because right now the booster is available to individuals who are immune compromised. We're looking and seeing in the media and some of these reports right now that it looks like the federal government's going to recommend boosters for anybody who's received the vaccine 8 months after they originally got it. So we're looking at mid-September for boosters being available or recommended for the general public. We're still waiting on those official guidelines, but we anticipate that will happen. We'll begin planning for that, but people that are immune compromised can get that booster shot now.
Thanks, Olga.
Thank you, Olga. Okay, and that concludes our new condensed format just for today. News conference, please, again, we encourage you to watch the virtual town hall from the Texas Tech University system and the Texas Tech Health Science Center and the Health Science Center in El Paso. We have those links on our Facebook and Twitter accounts. Thank you very much.
Thank you. Bye.